Hello everyone, I'm Dr. Joseph Thomas. I'm a professor and head of the Department of Plastic Surgery at Kasturba Medical College and Hospital, Manipal. Today I'd like to speak to you about a topic which is dear to me as well as most plastic surgeons across the globe, which is about cleft lip and palate. Cleft lip and palate is a very common birth defect affecting maybe 1 in every 1,000 to 2,000 births. It is commonly diagnosed before birth itself during your antenatal scans, where your radiologist or your gynecologist will tell you about this problem that might exist when the child is born. After the child is born, immediately we start with counseling about how you need to feed the child and what are the problems that the child may face, and the course of treatment the child may have to undergo throughout the initial days, as well as following surgery and everything else that needs to be done beyond that. Cleft lip is a defect where you see a discontinuity of the upper lip, because of which the grotesque appearance of the face is seen. A child with cleft lip typically undergoes surgery between 3 to 6 months of age. This is ideal because the child can then feed easily and the scars that result from the surgery are nearly invisible. Here at Kasturba Medical College, Manipal, we have a dedicated team of cleft surgeons and allied health professionals who help your child undergo the procedure and rehabilitate to have a near normal and fruitful life. This is a procedure that requires technical expertise as well as a multidisciplinary team, both of which we have at our institute here. After a cleft lip surgery, the child may have to undergo several other procedures for correcting certain other deformities that can be treated during the future course of his or her life. Moving on to cleft palate, this is a problem that exists within the oral cavity, the roof of the mouth. There is a defect which needs to be operated on. Typically, it is done between 6 to 12 months of age, and it needs to be done before the development of speech for the child. Surgeries for cleft palate are important mainly for speech. Speech is something that is very essential to us as social beings, and children typically after cleft palate surgery have near normal speech and can integrate into society without much evidence of the surgery or the defect that the child used to bear. So if your child or child of someone you know suffers from these defects, be sure to consult a cleft team. Thank you.